Hi, it's Jane, and on Healthier You today, this is the last of the series for the older aging adults, and it is simply 15 tips to keep your bladder healthy. Last week we talked about urinary incontinence, so this week we're just going to talk about some tips that can help keep your bladder healthy. First, the medical disclaimer. Always check with your physician before starting any exercise, dietary problem, or any issues that you are having as an older adult or even as a younger adult. Information here is my personal research into different health topics and is not to be considered medical advice. And as you can see, my nose is itching, so the allergies are bad today. So, 15 tips to keep your bladder healthy. People rarely talk about bladder health, and that's true. But everyone is affected by it. Located in the lower abdomen, the bladder is a hollow organ, much like a balloon that stores urine. Urine contains waste and extra fluid left over after the body takes what it needs from it. From what we eat and drink each day, adults pass about 1.5 quarts of urine through the bladder and out of the body. And there are days I feel like I pass more than that. As people get older, the bladder changes. The elastic bladder tissue may toughen and become less stretchy. A less flexible bladder cannot hold as much urine as before and might make you go to the bathroom more often. The bladder wall and pelvic floor muscles may weaken, making it harder to enter the bladder fully and causing urine to leak. And that is probably the most common thing for women. A lot of those issues revolve around childbirth, not getting proper education after childbirth, how to re-strengthen our pelvic floor muscles, those kind of things. While you can't control everything that affects your bladders, here are a few steps you can take to keep it as healthy as possible. Use the bathroom often and when needed. Try to urinate at least once every 3 to 4 hours. Holding urine in your bladder for too long can weaken your bladder muscles and make a bladder infection more likely. That is a big thing for a lot of us. I know as a nurse, I was lucky if I got to go to the bathroom once during a shift. And then it's only because I couldn't hold it any longer. Yes. So don't do that. Do that every 3 to 4 hours. Be in a relaxed position while urinating. Relaxing the muscles around the bladder will make it easier to empty the bladder. For women, hovering over the toilet seat, how many of you do that? May make it harder to relax, so it's best to sit on the toilet seat. And you know there's a hack going around using a plastic grocery bag where you slip it over the toilet seat if you're afraid of the toilet getting germs. Now, I worked with a nurse who hovered. She now has serious bladder issues, so it's not a good idea. Take enough time to fully empty the bladder when urinating. Rushing when you urinate may not allow you to fully empty the bladder. If urine stays in the bladder too long, it can cause a bladder infection. This one always gets me. Wipe from front to back after using the toilet. Women should wipe from front to back to keep gut bacteria from getting into the urethra. This step is most important after a bowel movement. I agree. Don't do that. But for many of us, we can't wipe from front to back because we're not agile enough to get our hand up under our leg and do that. So many of us will wipe front towards the back or even front towards the front and then reach around and do the back. Do what works for you. Just make sure you're not bringing the back into the front. that's going to cause issues. This is the most important one for women. Urinate after sex. Sexual activity can move bacteria from the bowel or vaginal cavity to the urethral opening. Both women and men should urinate shortly after sex to lower the risk of infection, but most especially women. I mean, unless you've used a condom, you get it. Do pelvic floor exercises. Pelvic floor exercises, also known as Kegel exercises, can help urine in the bladder. But there are more important exercises that go along with those Kegel exercises, and that's just plain pelvic floor exercises, keeping your pelvic muscles in shape. And a lot of us as we get older don't even do that. Doing those Kegel exercises can help hold urine in the bladder. Daily exercises can strengthen these muscles, which can help urine from leaking when you sneeze, cough, lift, laugh, or have a sudden urge to urinate. These exercises also may help avoid infections by strengthening the muscles that help empty the bladder. This is one that how can I put this gently? If you're wearing some of that sexy lingerie, you're going to have a hard time following this next tip. Wear cotton underwear and loose-fitting clothes. Wearing loose cotton clothing will help keep the area around the urethra dry. Tight-fitting pants and nylon underwear can trap moisture and help bacteria grow. So there you have it, women. Exercise regularly. Physical activity can help prevent bladder problems as well as constipation. It can also help maintain a healthy weight. Keep a healthy weight. People who are overweight may be at higher risk for leaking urine. Making healthy food choices and being physically active can also help with keeping a healthy weight. Watch what you eat. These are some of the things that I think are interesting because some of them I'd never really heard about. Caffeine, yes. Watch what you eat. Some people with bladder problems find that some foods and drinks, such as sodas, artificial sweeteners, spicy foods, citrus fruits and juices, and tomato-based foods, make bladder problems worse. Changing your diet may help you feel better. I had never heard that about the citrus fruits and juices, spicy foods, or even tomato-based foods. So that's interesting. Drink enough fluids, especially water. More than half of the human body is made up of water, so it's important that you are drinking enough. How much water you need can vary based on your size, activity level, and where you live. In general, drink enough fluids so that you need to urinate every few hours. Some people need to drink less water because of certain conditions, such as kidney failure and heart disease. So that is something you need to talk with your healthcare provider about how much fluid is healthy for you, and that's going to depend on your issues. Limit alcohol and caffeine. For many people, drinking alcohol can make bladder problems worse. Caffeinated drinks like coffee, tea, and most sodas can bother the bladder and increase symptoms such as frequent or urgent need to urinate. Cutting down may help. And I will say sometimes even just the whole carbonation of the fluid can irritate your bladder. When you consider the carbonation, think about the acids that they add to it. And I'm sure that causes some irritation there. Avoid constipation. Too much stool built up in the colon, called constipation, can put pressure on the bladder and keep it from expanding the way it should. So eat plenty of high fiber foods like whole grains, vegetables, and fruits. Drinking enough water, being physically active can help prevent this from happening. Quit smoking. Bladder problems are more common among people who smoke. Smoking can also increase the risk for bladder cancer. If you smoke, take steps to quit. Know your medications. Your medications may make it more likely for your bladder to leak urine. Medications that calm your nerves so you can sleep or relax may dull the nerves in the bladder, and you may not feel the urge to go to the bathroom. There are some common bladder problems that you need to be aware of and when you need to seek help. Bladder problems that can disrupt day-to-day life. When people have bladder problems, they may avoid social settings and have a harder time getting tasks done at home or at work. Common bladder problems include urinary tract infections, urinary incontinence, and urinary retention. Some signs of a bladder problem may include inability to hold urine or leaking urine, needing to urinate more frequently or urgently, cloudy urine, blood in the urine, pain or burning before, during, or after urinating, trouble starting or having a weak stream while urinating, trouble emptying the bladder. If you experience any of these symptoms, talk to your healthcare provider. Treatment for bladder problems may include behavioral and lifestyle changes, exercises, medications, surgery, or even a combination of these things. And you know what? There are videos on bladders and aging. And yes, some of them are on YouTube. I will also provide the links for these down below, such as National Institute of Diabetes and Digestive and Kidney Disease, National Kidney and Urological Disease, Clearinghouse information, and the National Association for Continence. Those may be some sources that you would like to refer to. And as always, that is it for today's video. I hope it gave you some information to help keep your bladder healthy, especially as we age. We're going to need some of that. So that's it for today. Next week, we'll start a new and different type of healthier you. Hope you guys enjoyed it. See you guys again soon. Everybody have a great week. Bye.